Good morning, afternoon, and evening to everyone, and welcome to Global Insights, a live weekly interactive panel discussion that sheds light on big issues currently facing researchers, policymakers, and planners worldwide. Global Insights features experts from leading institutions in the study of international affairs, including the Balsillie School of International Affairs in Canada, Konstanz University in Germany, Warwick University in the United Kingdom, the American University in Washington, D.C., and the Institute of Strategic Affairs in Addis Ababa, Ethiopia. Today's live stream panel is entitled COVID-19 and Gender Divides. My name is Fitz-Gerald. I'm the director of the Balsillie School, and I'm delighted to be moderating today's session. A warm welcome to all participants in the audience, and we have many of you today. We would invite you to direct any questions you may have using the Q&A function on your Zoom panel. We will do our best, especially in the latter part of the session, to direct those questions to the relevant panel members. We are privileged to host 5 well-known experts, global experts today on issues related to gender and feminism. Professor Juanita Elias is a professor of international political economy at the University of Warwick, with research and teaching interests in the area of gender, work migration, and the political economy of Southeast Asia. She is the author of Gender Politics and the Pursuit of Competitiveness in Malaysia, Women on Board. She served as a commissioner on the Political Studies Association Commission into the Crisis of Care in Austerity Britain. Jenna Hennebry is an associate professor in the Faculty of Arts in the Balsillie School of International Affairs at Wilfrid Laurier University in Canada. She is co-founder and past director of the International Migration Research Center and the coordinator of the Women and Gender Studies program at Laurier. Her expertise centers on gender and migration with an emphasis on labor migration, governance, and gender responsive migration policy, and migrant workers' rights, health, access to decent work, and social protection. Dr. Sehin Teferra is the founder of Setaweet Movement, an Ethiopian feminist network that works for gender equality and justice. Setaweet's latest project is Alenta, a hotline for survivors of sexual violence. Sehin represents Setaweet on the advisory board of the president of the Federal Democratic Republic of Ethiopia, and she is a member of the Destiny Ethiopia initiative that aims to reshape Ethiopian politics. Professor Liane Wörner studied law in Leipzig, Gießen, and Madison, Wisconsin, United States, completed her doctoral and postdoctoral studies at the law faculty in Gießen, Germany, before she accepted a call from the University of Konstanz law faculty in 2018. She is a specialist of international and comparative criminal law since 2017, a member of the Global Diplomacy Lab, and conducts research in gender and criminal law, and is the mother of 4 children. Dr. Nina Yamanis is a global health scholar who studies social determinants of health and community-based interventions to improve health. She specializes in HIV prevention for adolescent girls in sub-Saharan Africa and in Latinx immigration health in the United States. Welcome to all of you today, and thank you so much for being with us and participating in this incredibly timely debate. I'd like to kick off with a broad question about the pandemic and how this pandemic has impacted on women's rights. Let's start with Jenna Hennebry. Jenna, what has changed? What has stayed the same?
Thank you, Anne. Well, I sort of feel like we're 1 step forward, 2 steps back. The step forward, I think, has come from a recognition of the key roles that women play in the economy and social provision, in paid and unpaid work, and greater attention to the leadership of women during the pandemic. Also, there's been increased claims making by women and civil society groups around women's human rights. But at the same time, we've also seen some significant steps back. We've seen women's double day in paid and unpaid work significantly exacerbated. And we've seen in the private, public spheres, in the home and in the workplace, it's meant a re-entrenchment of gender roles, sort of the homework, care work, double day, heightened gender inequality, wage gap, unemployment, for example, political participation and mobility restrictions have been heightened. We've also seen increased gender-based risks with increased domestic violence.
Thank you. Nina, Yamanis, how has the pandemic affected pre-existing inequities?
So women are less likely to participate in the labor force compared to men. And the pandemic certainly has limited their participation in the labor force, especially those women who have children. And I worry that they will be unable to, some may permanently exit the labor force because of the pandemic. In terms of education, we already know that girls have worse educational outcomes compared to boys. So I also worry that as the economy contracts, especially in low-income countries, that girls are not going to get to go back to school as families have to make decisions about who to send back to school, which could affect girls' long-term educational outcomes. This job stress and pandemic stress could also, as Jenna said, increase violence towards women, and women already experience higher rates of violence compared to men. And with less social protection and more social isolation, I fear that violence could increase towards women.
Thank you very much. Professor Liane, Wörner, you're coming in from Germany. Tell us about some of the gendered impacts on German society.
In brief, women are more likely to be expected to stay home and to work from home, and especially to take care of children and elderly. The gender care gap is sufficiently documented, but it's significantly increasing also in Germany within the crisis. Lately, a study by the German Institute for Economic Research stated that during the pandemic, mothers spent 36% more time with their children, fathers only 9%. Those numbers do have reasons. When families have to make a choice, they choose to maximize family income, which in many cases results in women staying home since they still earn less. Childcare, schools, home care services, grandparent times, family care workers were mostly easing the burden of women and allowed them to work. Most of them had to be canceled due to the minimum distance rules. A survey at the University Konstanz showed that female scientists, that's very interesting, more likely giving caretaking responsibilities priority compared to research. That's also a problem. Carla Baum, lately in the Zeit, made aware of another phenomenon, which I want to mention here, the Krisenbienchen. In English, the crisis busy bee. Irritatingly, women seem to restart stereotype crisis hobbies like cooking and baking, seaming clothes, or knitting, independently of having kids or not. Jutta Almendinger, the president of the Science Center for Social Science in Berlin, clearly stated that it's very difficult for women to find decent jobs after a parental leave and to cope with male colleagues. Corona is producing an additional parental leave for many women. Some ages 40 and older, so like Nina was explaining already, even question to go back at all. I agree with Almendinger. In the long term, that will also increase dependencies from partners. Thank you.
Thank you very much. Sehin, you're coming in from Addis Ababa, Ethiopia. Tell us how this is being felt on the ground in Ethiopia.
Thanks, Anne. Listening to everybody else, I'm kind of amazed how similar gender is everywhere, except of course, Ethiopia is highly food insecure, and that's very much a gendered issue. So I'd like to talk a little bit about that. Women are kind of the first to lose their jobs. Obviously, a lot of the women in Ethiopia work in the informal sector when they are employed. There was a really fascinating study by Population Council that put the percentage of women who work for pay at 36%, so incredibly low. So all Ethiopian women work, but very few of us actually get paid for that work. And this is highly impacted by the Corona crisis. We see women really struggling to feed their children, and particularly when they're out of school, because the school feeding program had kind of really covered that obligation. And water is a highly gendered issue, fetching water even in urban areas. That's the job of girls and women. And with the need to wash more and keep ourselves clean and all these messages of washing hands, that's more work for women. Women are in the care economy, highly gendered, obviously, like everywhere, taking care of elder parents, taking care of children when people are sick. And we have a very highly socialized community, so there's a lot of social obligations, and obviously that falls on women. So I can't remember who said the double work. I think it's actually the triple work in the case of Ethiopia, because you have the social work as well. And with the informal workers, something that's really neglected is sex workers. A big population of Ethiopian women are employed in sex work, and they're obviously losing their income. They don't have money to feed their children, that kind of thing. So all impacted on gender. Thank you.
Thank you. Juanita, Elias, come in and tell us if, in your view, the COVID-19 crisis is leading to a gendered crisis.
Yeah, well, I think it's quite apparent from what all of the fellow panelists have been saying just now, is that the COVID pandemic is something that really serves to expose some deeply gendered inequalities. So things like lockdown, school closures, requirements to work from home, social distancing measures mean that the burdens associated with everyday tasks like caring and maintaining and provisioning for the home, these kinds of tasks have really, really multiplied. And these are the kinds of tasks that feminists call social reproduction, and these are the tasks that have really increased within households. And these are really important gender issues, because these are issues that women overwhelmingly take responsibility for. And so thinking about these kinds of issues in the context of the COVID-19 pandemic, and thinking about the pandemic as a form of gendered crisis is really important. My colleague at Warwick, Sehin, has coined the phrase depletion through social reproduction, which seeks to capture the ways in which the unequal distribution of burdens of social reproduction constitutes a form of harm which impacts individuals and their communities. So there's often this assumption that women are able to kind of pick up the slack in terms of crisis, in times of crisis. And what we see is what a lot of feminist political economists have pointed out, is that these assumptions are really untenable. They sustain inequality and impact women's physical and mental well-being, as well as undermining the social fabric more broadly. And as some of the other people on the panel have already mentioned, the gendered harms associated with lockdown or movement control orders are also quite starkly evident around the issue of domestic violence. So here in the UK, domestic violence organisations scrambled to get the message out that their services were still open, and they had to work quickly to ensure that the message got out that women trapped in violent relationships should not be forced to stay put during the lockdown period. The issue of domestic violence has been something that's been discussed in many different countries. In another country which have a significant interest, that of Malaysia, there we saw the Ministry for Women and Community Development put out some extremely problematic advice to women, suggesting that during this period under what was called the movement control order, they shouldn't nag their husbands, they shouldn't let their usual standards of dress slip, that kind of thing. And although these comments were hastily retracted, such statements really illustrate the way in which issues such as domestic violence are often seen as an individual issue that women simply need to manage, rather than an issue that reflects deeply ingrained structures of gender inequality.
Thanks very much. I want to turn to the economic issue at the moment, because many commentators have been referring to the economic downturn as a she-cession. Nina, Yamanis, what are your views on this?
Yeah, so we know that income inequality rises for 5 years after a pandemic, and so this is a long-term issue we're going to see. And I think the Washington Post labeled it a she-cession initially. In the US, female unemployment has actually exceeded male unemployment, and that's different from the Great Recession of 2008, and it's really unusual for a recession in general. And this is primarily because women are in jobs that require face-to-face work, and this can be leisure, travel, hospitality. That explains partly the higher unemployment for women. We also have seen some evidence that women business owners are not taking advantage of the Payment Protection Program, which provides them loans for their businesses. In the Global South, I think, low-income households often experience worse effects of income shocks. So we're going to see low-income households experiencing worse effects, women being more called upon to do caregiving tasks, and thus women potentially exiting the labor market. We also see, as Sehin suggested and talked about, women participating in the informal sector, which means that they may not have social protections such as job security and unemployment and so on.
Thank you. Well, let's go to Sehin with that comment. Sehin, you're projecting in from a part of the world where remittance funding is very important to buffer these types of economic downturns. What are you seeing might be the impact on remittance funding, gendered migration, etc.?
I think we're already seeing the effects on gendered migration because we've had a really big kind of case of migrants stranded, particularly in Lebanon. Ethiopia gets more money from remittances than we do from exports and FDI. So it's an incredibly important sector. It's a highly neglected sector, and we're kind of paying the price for it. So we've had a few people returned with barely any money because of the crisis in those countries as well. And now they're in quarantine. So it's a whole disaster, but it's definitely going to affect us long term if women are not able to travel, men and women, if they're not able to travel, if they're not sending remittances, our society will struggle. But can I just add, with the protection of labor laws, Ethiopia has enacted a directive very early on the crisis, during the crisis, that employers are not allowed by law to let go of their workers. So this is great, but there's no research to find out if that's actually the case because people are losing money. I don't know how long they can keep their workers at bay. And I think it was Juanita who mentioned it. A lot of women are employed in the service sector. They're hairdressers or they're waitresses. So these hospitality sectors are definitely losing money. So it's going to be something we're going to see in the very, very, very short future.
Thank you. I want to pick up on your comment about care workers and social protection. Jenna, you do a lot of research on this area. What can we learn about the importance of care work and those who perform it in considering the global political economy?
Well, we could have a whole panel on that, I think. Women are, as we know, concentrated in the care economy, and as Juanita and others have pointed out, women represent 70% of health and social service workers worldwide. And so we know most care workers are women, and frequently they're migrants. In fact, 11.5 million domestic workers are women worldwide. The ILO estimates there's roughly 67 million domestic workers around the world, and roughly 80% are women. And we know in Canada that the service sector makes up 72% of the national GDP and nearly 80% of total employment, and women are concentrated in that sector as well. These are sectors that are basically all going to be hardest hit because of the pandemic, both the pandemic and its response, in terms of health risks, but also economic risks and heightened precarity, as well as some of the other factors that we've been addressing. In addition, when we look at overall spending on social provisioning from governments, we have seen patterns borne out in the last few months. Those governments that had pre-COVID or pre-coronavirus spending that was high on social provisioning have fared better in terms of outcomes of cases, as well as severity of response in terms of lockdown time.
Thank you very much. Liane, let me turn to you. How is COVID affecting women's ability to participate when trying to work at home, juggle all these balls? You have 4 children, but I have to say collectively the panel has 15 children. We're all working full time. Tell us more.
So thank you for that question. It's kind of a little bit more personal, I have to say, and admit I never saw that many sunrises. Then within the last weeks, it's enough for at least 2 lives. Well, the results are maybe more from a little bit personal point of view. You have to cancel many interesting projects. You just can't cope with all of them. You have to teach asynchronic, producing podcasts, which is even more demanding than straight online teaching. Well, there's absolutely no chance to take a breath. So you never have any time for anything. Many experience the problem of working space. I think that's a huge problem, which has never been discussed about. with kids playing around everywhere in the house. You don't know where to work at all. Well, what shocked me most in the field of science is that it's, at least in Germany, and I bet it's the same in many other countries, it's almost expected to take teaching reductions if you have caretaking duties. That was not only suggested by our neighbors who were wondering why I was not out playing with the kids, but working instead of. It was an official suggestion by the university's Gender Equality Council. And that's definitely the wrong direction of things. In science, while for many, I would say the pressure is high to now produce articles and scientific results because there are no conferences and we don't have to meet, there's no administrative work kind of. It's a even higher pressure for those who cannot cope with all the due to caretaking for others. So especially junior scientists experience an additional timeline pressure. In a long term, the pandemic will have a negative impact on their scientific outcomes, and it's impossible to hold deadlines for them.
Thank you. Nina Yamanis, what are your views on this issue of social care provision? Are we looking at a crisis in social care as well?
I think so. I think, like Jenna mentioned, you know, women are more likely to do face-to-face work even in the healthcare industry. So they're more likely to be nurses, they're more likely to be even more exposed to COVID because of their roles. They also may be more likely to intervene when patients are having trouble breathing or difficulty crashing. And so then, you know, we have seen actually deaths of nurses, for example, because of these kinds of things. They've intervened and then passed away. So I think this role of women as social care providers, both impacts our health in terms of mortality, but also, just as Liane mentioned, impacts overall morbidity and stress and mental health effects because of the triple burden of care for children, work, and care for the society.
Thanks. Juanita, what are your views on this coming from the UK? On the issue of social care?
Yes, so since around about 2016, I've been very focused on looking at the social care sector in the UK. And I think that we're now seeing the social care sector really being focused on in discussions of debates around the impact of COVID-19. The problem in the UK has been that this is a sector, and I'm particularly interested in the aspects of social care that relate to care for older people. So this is a sector that has been absolutely catastrophically impacted by UK government austerity policies that have been in place since the 2008 financial crisis. And these policies have led to a worsening of an already significant funding crisis in the sector, which has seen further deterioration of working conditions, the ongoing privatisation of the sector, and an ever-increasing reliance on family members, usually women, to take up unpaid care work. So in a sense, it's back to the comments that I was making earlier about women being expected to take up the slack during times of crisis. But I think this also speaks to something that Jenna was mentioning around the importance of having kind of robust systems of social protection in place as part of the way in which coronavirus needs to be tackled. And that's something that unfortunately has not been in place in the UK. In the UK, much of the policy response to COVID-19 has centred the importance of protecting the National Health Service. But what's starkly evident now is the protection of the National Health Service has been at the expense of a social care system. And those who work in the social care system, either they're working in care or nursing homes, or they're involved in kind of home visits for older people, they're disproportionately female, and you have very high levels of representation of ethnic minority and migrant women in the sector. They've been really seriously impacted by shortages of protective equipment, lack of clear government guidance, and the release of COVID patients into care homes, which has placed these workers in uniquely vulnerable positions. And what's more, the incredibly low wage and unprotected nature of this work has meant that many workers have often been forced to work even when they are unwell in order to support their families. So you have very high levels of single mothers, for example, working in social care, and they're simply not able to take the time off. So there's this kind of ironic situation, because on the one hand you have this increased celebration of care workers, and care workers have even now been given their own badges to wear to kind of recognise their importance, but it's not really enough. What we're not seeing is care work being better paid, and working conditions for these workers have actually deteriorated further. So I do think the care sector is a very clear example of how the health crisis is sustaining very, very gendered economic inequalities.
Thank you very much. I want to turn to how the pandemic is affecting women's physical and mental health. Sehin, I'm going to start with you. What are some of the issues with respect to safety and security for women and girls in the home?
Was that addressed to me? Sorry.
Yes, to you. What are some of the issues of safety and security for women and girls in the home?
Well, predictably, like everywhere in the world, we've had a rise in domestic violence. Unfortunately, we don't have good numbers in Ethiopia as a percentage, but the organizations working on this are definitely reporting a high rise, sexualized violence, domestic violence. Rape against boys is really on the rise, surprisingly. I mean, that's something that needs further study. But perhaps uniquely for Ethiopia, child marriage is on the rise, particularly in the Amhara region, which traditionally has one of the highest rates of child marriage in the world. We've had, since schools started closing in March, we've had something like 300 child marriages that are actually recognized by the government. These are predictable because in a society where women are not valued, people don't want to spend money taking care of their daughters, and if they're not in school, they're taken out and to be married off. So these are some of the trends we're looking at.
Thank you. Nina, Yamanis, what are the health outcomes at the household level by way of the pandemic?
Yeah, well, I think one, just COVID-related deaths could be higher among, as I said, healthcare workers, especially who are in face-to-face interactions, and anyone caring for someone with COVID-19, and that generally tends to be women. But then we also have to think about indirect deaths as a result of COVID-19, and in some countries, those deaths could be more than who are dying from COVID-19. Those indirect deaths could result from people not going to the doctor when they need to go, for example, for heart conditions or normal chronic diseases, or providers who have to shift to pandemic response and are not available to serve the general population and their health needs. One Hopkins study recently predicted that if this health service use contracts by 50%, that we'll see over 1 million child deaths and 50,000 maternal deaths. And I think those are mostly because of high rates of diarrhea and then maternal mortality, women who are pregnant not being able to get to facilities. So in the case of Ebola in Sierra Leone, we actually saw a 36% increase in the maternal mortality ratio at healthcare facilities. We saw a decrease in vaccination rates, increase in teenage pregnancy. So we have an expectation that these things are going to happen as a result of COVID. I also worry about diseases like HIV, where we may see a decline in our ability to control HIV, especially in countries that are heavily impacted by HIV. In sub-Saharan Africa, where we know girls have 2 to 3 times higher the rates of HIV compared to men. So I expect some declines in control there as well.
Thank you very much. Liane, Wörner, you study criminal law. Tell us about your views on violence against women and how COVID has impacted on this.
Well, according to the UNFPA, women represent, as some of us mentioned already, well, not in numbers, 70% of the health and the social sector globally. And already their work environments expose them to increased risk during those pandemic. Women and girls are at a higher risk of domestic violence. Sexual and reproductive health rights have been negatively impacted by the pandemic, including safe pregnancies and childbirth. That's a problem. In Germany, let's look at those facts. Due to the pandemic, at first, many women's shelters were closed or had to be closed due to the rules. Partly helplines were not available. I'm sure that's not a German national problem. It's a problem everywhere, and it's worse even everywhere. Problematically, female police officers who play a very important role in violence against women cases had to stay home to take care of their own children. That's another fact we have to face. Also, first studies show that women less likely call the helpline or the women's shelter during the pandemic because they are afraid not to reach anyone or not to be heard. Well, the rules ask them to stay home, right? So that's a problem, another one. In Brandenburg, Germany, only in May, 3 women died, most likely killed by their partners, which is a high number for that comparatively small part in Germany. Thank you.
Thanks, Jenna Hennebry. Let's go to Canada for a minute. This is where you're projecting from. We have a Feminist International Assistance Program, and that must mean we're doing something right at the domestic level as well. So tell us, how, in your view, how Canada is faring on this issue.
So in Canada, while we have a feminist international assistance policy, we don't have a feminist government per se for all aspects of governance within Canada. We do have something called the gender-based analysis system that's supposed to analyze sort of all policies and programs from a gender lens, so that's important. And there has been aspects of gender-based budgeting introduced, and that's also important. But that tends to be looking backwards, not sort of responsive in this kind of way. And we have seen gender-based violence increase in Canada in this period of time, similarly to other countries like in France, for example, and China and others. The reality is that coronavirus is attacking both our intersecting biological and socioeconomic vulnerabilities. So gender, race, and socioeconomic status all come into play here. And at a government level, the response, particularly around those acute things, has not been particularly good. Things such as enhanced access to social protection has been good, and Canada's being touted as one of the sort of good practice examples. So, for example, increasing child tax benefits to up to an additional roughly $126 for a single parent family, for example, and versus a two-parent family getting double that. And so they've increased that, and that has helped considerably with some of the economic components. But in terms of addressing increased violence or the increased health risks that women face, not significant enough. So we've seen in Ottawa, for example, which is our capital city, there's been nearly 2,000 cases that are women. So that's 60% of the cases in that city. In Quebec, as the province of Quebec, we've seen disparity there of cases, women making up, again, nearly 60% of cases and more than 50% of the deaths. And we know that women are concentrated in long-term care homes as well. And so we have 75% of residents age 85 and above in care homes in Canada. The government has done some things to try to address the urgency of the vulnerabilities of populations in care homes, but insignificant amounts.
Thank you very much. Juanita, Elias, finish us off on this issue, please, on mental and physical health and the impact of COVID on this.
Okay, so one of the things that you had previously asked me to reflect upon was not so much on the issue of the kind of issues of mental and physical health, but maybe one of the things that we also need to talk about in this context is the way in which COVID-19 is creating a kind of more of an intersectional gendered crisis. And, you know, what we do know is that in the UK and in North America, it's been very clearly identified that Black, Asian and minority ethnic groups are far more likely to die from coronavirus. And this demonstrates the way in which the virus operates with very, very entrenched socioeconomic inequalities. And one of the things that we need to think about is that as this health crisis becomes an economic crisis, the impact of the response to the virus really needs to be understood as something that impacts poor, marginalised and racialised populations far more severely. So gender is part of that story, but we can't just look at gender alone. We have to look at all of these kind of intersecting structures of oppression. And I think also one of the things that we need to keep in mind is that responses to the virus, such as lockdown, are often based on assumptions about a particular type of household. Probably the type of household that the policymakers themselves live in. So affluent middle-class households, nuclear families, in which, you know, rather than multi-generational households in which there's no risk of passing on the virus to older household members, households in which it's possible to work from home, at least in some sense, households in which you have access to digital technologies that enable homeschooling, that kind of thing. It's easy to say safe, it's easy to stay at home, but what the thing we really need to think about is, how do you stay at home if you don't have a home? How do you stay at home if you're a daily waged or a 0 hours worker, or if you're a migrant worker far from home? So I think it's really important to point out that many of the issues facing some of the world's poorest and most marginalised peoples have not gone away simply because of the virus. And sometimes these issues have worsened due to very misguided approaches to public health or the impact of economic recession, eviction of
Juanita, I think we're
protesters and trade unionists. Okay. All of these things continue. Okay, yeah, I think this is due to my son playing computer games downstairs. So
don't worry, very appropriate comment to make.
But anyway, so basically, you know, gender inequality is part of this kind of a tapestry, a wider tapestry of injustice. And so, you know, we can't just look at gender as the only way through which we understand this crisis.
Right. And can I just pick up on you on one thing, if you can answer in 5 seconds, please, so we can move on. A question from the audience has looked at this issue of disproportionate impact on women of color. Are there any programs or policies or outreach in the UK to address this at the moment?
Well, I mean, so we had a very interesting press conference a couple of days ago with our health minister, where he actually used the phrase Black Lives Matter. But I think that, you know, that was much more about kind of expressing concern and compassion rather than putting in place policies to really address the way in which COVID-19 is disproportionately affecting Black and minority ethnic communities. You know, in many ways, the state's response has been wholly inadequate. But I imagine that there are, you know, most likely a lot of kind of community level responses to this issue, but, you know, really that's not enough.
Thanks very much. Let's move on and look forward. We've heard a lot of worrying trends. We've heard a lot about doom and gloom and she sessions and triple crisis. Let's try to look forward now. Sehin, I'd like to ask you if you feel that the coronavirus will, as some commentators have suggested, spell a disaster for feminism.
Yes, that's the Atlantic article that's called Corona, the end of feminism or something like that. No, I don't think so. I think it's definitely a step back for women, particularly in developing countries like Ethiopia. We definitely risk losing some of the gains we've made over the last few years. And let me just give you a couple of examples. In Ethiopia, we're actually very early on the pandemic scale. So I was just checking the numbers, and we have 1,600 cases, out of which 250 have recovered and only 18 deaths. So quite early, it's quite early for us. But we've already seen a couple of things that will really spell danger, and that's a decrease in vaccination. in the reach of vaccination, something like 67%, but we're risking losing it. Ethiopia's really struggled to reduce maternal mortality rates. It's currently at 412 per 100,000 live births. And if women start giving birth at home because they're afraid to go to medical centers, then this is really a setback for Ethiopian women. So that's really worrying. And our blood banks are already depleting in stock. So these are the kind of real life concerns. I think we will definitely lose in terms of employment and in terms of our overburden in the care economy. But I think there's also an opportunity for women's leadership. Ethiopia's corona response is led by Dr. Liane, a young woman, and I think she's doing a fantastic job. And you have communities getting together and doing kind of the mutual aid work now that's Western countries are just picking up on. So I look at posts from the US and they're talking about mutual aid support groups. And these are things that Ethiopians have done for generations, and a lot of them are led by women. So I think there's definitely an area for women to come with unique responses, with creative responses, and kind of bringing in the emotional intelligence component that we will need to beat Corona. So it's a setback, it's not the end of feminism.
Oh, good to hear. Liane, can I turn to you and ask you, what does this mean for gendered roles moving forward?
I think it's not only a challenge, it's a chance. So globally, gender norms still translate into women being viewed primarily as caregivers and men being viewed as leaders. Topics like foreign policy, crisis response, and trade have traditionally and wrongly been seen as gender blind or gender neutral. The pandemic has forced a focus on real-time analysis. Now we do have an opportunity to create lasting change. Well, we need to bring into focus women, unseen yet essential role in labor. In healthcare, 77% essential workers are women. In retail, 53% essential workers are women. It's according to a New York Times study. There are very successful women in leadership during the crisis, like Angela Merkel in Germany. That's only one example, we all know. Not at least, women are not to be reduced to caregiving. That we have to rethink apart from gender roles, not only on behalf of women, but also on behalf of men. Allowing and valuing caretaking for anyone. We have to evolve from judging by gender roles, race or color, but judge by situation and allow chances to anyone.
Thank you. Jenna Hennebry, does this attention to gender inequalities pose an opportunity for positive change?
I think it's important to remember that the pandemic didn't occur in a bubble, though it has changed everything. We were already in a different moment in terms of feminism, right? Following on the heels of the Me Too movements, we know, for example, in Canada, according to Stats Canada, 13% increase in police reported cases of sexual assault directly sort of in that period of time. So we know that when there's increased public dialogue around gender and around gender equality and around violence, in particular in this case, we see people respond, and there has been a response. And so on the one hand, I'm optimistic that the same kind of dialogues we're having about the importance of care work, about the heightened inequalities, about the fact that gender pay gap is not only still present, but growing rapidly in the first few quarters, in the first quarter of this year. And so, I mean, I think that there has been enough public attention paid to this that I hope that that will continue the movement forward. In addition, we've seen the significant role that NGOs and civil society has had to play in this period of time, not only as mediators or brokers between the state and the individual, particularly around care, but around everything. But they've had increased role in the public sphere, I think, overall, and women dominate in that sector as well. And so I think that might pose opportunities there. In addition to that, we've had interesting and innovative forms of partnerships being developed and opportunities for engaging in the political sphere. That said, doesn't bode that well in terms of numbers of women as heads of political parties or as ministers of parliament worldwide. It's not as if you can take those new political responsibilities on when you're also at home juggling your care responsibilities and baking bread and writing papers.
Thank you very much. Juanita, Elias, what does this mean for the global feminist movement going forward?
I think that's a really interesting issue. I think as this global epidemic escalates, feminists from around the world have been very active in highlighting the gender impacts of the crisis and have really placed importance on the need to develop feminist approaches, for these approaches to be at the heart of all of these responses. Now, that's not to say that there is a global feminist movement that has a clear unified position on how best to tackle these issues. And I think that most women's movements are very much focused on specific national and regional issues. But I do think when we look at the kinds of things that women activists are raising around the world, there are some interesting commonalities. And broadly speaking, such responses are about integrating a concern with gender justice into a response to the pandemic. They include things like, firstly, the need to ensure that women's human rights are central to responses, and that regimes don't use the pandemic as an opportunity to roll back some of the gains of the women's movement, for example, issues around reproductive rights. Secondly, the need to ensure that women's voices are heard and that women's ability to engage in participatory decision-making in all areas of government is not further constrained because of domestic burdens that they're facing in the context of the pandemic. Another issue is the ongoing importance of thinking about gender mainstreaming within the public health response, economic and public policy measures, ensuring that policy objected to rigorous gender disaggregated data is collected in order to measure the impact of policies. And this becomes even more important as what is a healthcare crisis is a full-blown economic recession. Another issue, again, relates to the importance of recognising intersectionality, and then, of course, drawing attention to ongoing forms of gender injustice and really making sure that gender issues have not knocked off the political agenda. That is less important in the context of efforts to combat the virus. So this would include, issues like domestic violence or worsening gender inequalities, particular challenges facing female-headed households and disabled women, difficulties in accessing reproductive health care. They can't be seen as kind of second order hold until after the pandemic has passed. To do so will only worsen the gender impacts of the current crisis.
Thanks, Juanita. I want to turn to Nina because we haven't spoken about transgendered persons yet. Can you let us know your thoughts on, from a perspective of studying this issue, of what COVID-19 is impacting on this area?
Thank you for that question, Anne. Yeah, I think transgendered people face a number of difficulties. As we know, vulnerable communities are just made more vulnerable by the pandemic. And so in terms of healthcare, they may be reluctant to seek healthcare because it's not their usual healthcare provider, if they experience discrimination within the healthcare setting. Gender reassignment surgeries may have been halted. Hormones, which are needed to be taken on a regular basis, may have been halted also, which significantly impacts mental health and physical health of transgendered people. We also know transgendered people face more homelessness than the regular population, and at a time when we're requiring people to stay at home, they may not have a safe place to stay. In terms of employment, they also may experience more discrimination within employment. And we know that transgendered people are overrepresented in sex work, for example, so they may be needing to turn to sex work to survive, which could increase their risk for HIV and other sexually transmitted infections. We've also seen in some governments that they've explicitly had policies that have discriminated towards transgendered people. For example, in Panama, Peru, Colombia, they've restricted mobility by gender. So men are allowed to go out certain days and women are allowed to go out certain days, which completely ignores diversity in gender identity and makes them makes transgendered people particularly more vulnerable. And we've seen finally an increase in violence towards transgendered people. Just in the past month, we've had 5 murders of transgendered people in the US, and they were all people of color. I would like to see more emphasis placed on transgendered individuals in general, and an alliance with the women's movement, as the other panelists have discussed.
Thank you very much. I just want to turn to some of the questions from the audience in a little bit more detail now. Sehin, there's one from you here. A number of questions are coming in from the Horn of Africa region on how can local governments support and encourage sexual reproduction and health rights services, and how can the international community ensure that local governments act? The questions are suggesting that we've seen some groups use COVID to further their anti-SRHR agenda. Can you comment on that briefly, please?
That's definitely been our experience, and I don't know if the question is in regards to COVID in particular, because it's kind of this anti-SRH movement has been going on for the past 4 or 5 years, and definitely has a religious bent. It's dangerous for definitely visible reasons. There's pressure to not include sex education in curricula and in secondary school education, which is obviously dangerous because you need students at that age to know about sex, and it also extends further. There's talk about criminalizing sex work. Ethiopia has never criminalized sex work, and it's something we're definitely proud of. And we have very liberal abortion rights in Ethiopia. So with this increasingly anti-choice and anti-women really bent, we stand to lose a lot of opportunities to further equality.
Thank you very much. Another question concerns recommendations for childcare as the pandemic continues. Jenna, Hennebry, I want to put this to you. I also, if you can answer the issue of critical analysis of the responses from men as fathers, husbands, and sons of elderly or vulnerable people as well. You know, we're a completely female panel. That wasn't intentional, but I think we need to get this view taken on board too.
All right, well, let's start first by, you know, I think one of the recommendations I was going to make towards the end of the panel, I'll just say it now, which is, you know, we need to have an increase or a reinvestment or an infusion back into public infrastructure for social provision, which includes childcare. It also includes other things like parental benefits, for example. These things are vital, and they need to be things that are accessible, not just for citizens, but also for people without documented status, or migrant workers, or whoever, or without formal employment. All of these things, which is where women tend to be concentrated in many of those kinds of categories. So I think that's absolutely vital. And so I think the commentator, whoever offered the question, was bang on. You know, childcare is key to this. If we don't have childcare, there is no way forward out of this that's positive for the feminist movement, that's for sure. In terms of, and I wasn't entirely sure I understood your question, and or your comment, but I'll do my best. You know, gender isn't just about women, and I think that's a really important point that we highlight. It's about a whole range of intersecting identities and precarities, and some of them are about social norms, some of them are about the way in which populations are treated. There's a whole range of issues that need to be addressed there, and what where we see it, and where we have tended to see that gender pans out and has impacts that are more deleterious for women and for transgender people, in terms of, for example, income inequality or violence, like has already been discussed. And so that's why the attention to women, and that's why the attention to transgender people. But that doesn't mean that that the virus and the pandemic response has not had negative consequences for men and boys. Absolutely, we've seen high rates of unemployment, we've seen depression, we've seen illness and working in unsafe work. Lots of actually impacts there as well. I'm not sure if that addressed your question.
No, thank you very much. I think it did. And Nina Yamanis, we've got a couple of questions about statistics and data on long-term health impact on women who manage both a career and family. Are we seeing anything, or is there anything there to help us on this?
I think, yeah, I mean, I think women who are unemployed tend to be less healthy. You know, I mean, there's just a lot of data showing that women who have higher education, who are who are employed, have better health outcomes. So I think if you look at it that way, just in terms of a stark divide, getting girls back into school, retaining women in the workforce will ultimately impact their physical and mental health, and thus the health of their children. I mean, it is all very interconnected. It goes bi-directionally. Children's care impacts women, and women's health also impacts the health of their children.
Thank you very much. Two questions coming up, and I'm not sure who to direct them to. Liane, let's have a go with you on technology. People are wondering if technology is exacerbating this issue at all. Any thoughts? At the same time, Sehin, others are asking whether or not there's a big difference between the impact on the gendered movement in the global south and the global north.
So is the question more tended to ask, like, if the admission to technology has an impact on gender, or what is the question's tendency going to, like, that?
I think it's probably based on the development of apps. Can technology, let's spin it around, can technology be leveraged at all to address some of these inequities?
Oh, I'm not sure if you can nowadays still say, like, what is a very old saying, at least in Germany, that male or men are more able to go around with technology and develop apps than female are, because I think that's no longer true. So I think we both have the same way to use apps, and maybe right now within, or as part of the crisis, we use that more often than men do. Like, I couldn't work without my cell phone. I do most of the work while running around in the house, and they do all the emails with that. So
no, very true, very true. Sehin, what about anything coming out on how, is there a divide between the global north and global south on this issue, or are we united?
With the feminists, within the feminist movement, you mean?
Yeah.
No, I think there's a lot of replication. It's, for example, with the, as I mentioned, Corona came quite late to Ethiopia, but we kind of knew what to expect based on the trends from other countries and based on the reports of other feminist movements. So I think it could actually be a uniting force for feminist movements across the board.
And that's a good thing, especially in today's challenging times. We're running out of time, but I'd like to pose the last question to all panelists. We have lots of policymakers in the audience today. What would be your #1 recommendation or issue of consideration to them? Nina, let's start with you.
Well, I think social protection must be sustained beyond the pandemic. So all the stimulus payments and efforts that are being made now to support and protect female business owners, female-headed households, and so on, need to be continued because income inequality will continue beyond the pandemic.
Okay, thank you very much. Juanita, what's your #1 recommendation?
So I think this really goes back to things that we were talking about earlier. I mean, I think that one of the key things that we really do need to think about is how investments in childcare and older care can really create a kind of sustainable social infrastructure in which gender inequalities can be, you know, properly addressed, and having a well-paid, well-trained care workforce has really been something that's been underlined in this crisis, and it has worsened the crisis. And I think that's something that needs to be urgently addressed.
Thank you very much. Jenna, what's your one recommendation?
So exactly what Juanita said and Nita said, but also in addition to that, I think not turning away from global human rights instruments and agreements we have in place that are actually trying to move forward on gender equality. So SDGs, stand alone on gender equality, Global Compact for Migration, gender responsiveness, Beijing platform. These things are there for a reason, and so we need to take lessons learned from this moment that have, I think, laid bare some of the issues we've talked about. We need to address them with enhanced social protection, etc. But then we need to make sure that we move forward to try to fulfill those agreements.
Thanks so much. Sehin, one sentence or less. What's your #1 recommendation?
Yes, couple of things. First, engendering the response in real time, so not afterwards when we find out what we could have done earlier. So for example, in Ethiopia, there's the COVID response team. I don't think we have a gender person on there, and I would like to see that. Strengthening the GBV response mechanism, very, very weak in Ethiopia, and that's now we found out how incredibly important it is. And research. We don't have enough research on how to engender for pandemics. So those would be the 3 things.
Great, thank you. Liane, 5 seconds. What's your thought?
5 seconds is very short. Whenever developing instruments to manage that crisis, be aware of existing gender divides and include measures to redeem those. That's, I think, very important. That means in 3 directions. First, the Istanbul Convention on Preventing and Combating Violence Against Women and Domestic Violence applies in sickness and in health. We need consistent and constant services anywhere to help and to protect women and to prevent violence in the first place. Second, we need to stop concentrating on changing women into men and intense promoting men as also being caregivers. And third, from the perspective of universities, we need nationwide and beyond more options to support students, young researchers and scientists with caregiving duties in the crisis. Thank you.
We're out of time. Thank you so much to all the panelists. That was a fantastic discussion and so important. I'm sure the audience will agree. We hope you've all enjoyed it, and we hope you will join us again next week, same time, same place, at the same link, for an equally interesting discussion on COVID-19, war, peace building, and conflict resolution. Until then, take care, stay safe, and let's stay united during these challenging times. All the best.